Hello, my name is Sam Ahmedzai. I'm an emeritus professor from the University of Sheffield in the United Kingdom, and I'm going to be presenting an introduction to holistic needs assessment in palliative care and the role of SPARC. I do apologise that I'm unable to give this presentation in Spanish. Firstly, what do we mean by holistic in terms of healthcare? The word holistic is interpreted in different ways across the world. There are different concepts of well-being, happiness, fulfillment, satisfaction with life in all different cultures. There are important variations between cultures about how the individual is seen in relation to the family and the broader community. Also, how we see spirituality. Is it religious? Is it existential for non-religious people? And especially, what about the meaning of life and death? And then we have different ways of looking at materialism, especially when it's financial materialism versus a broader ecological view of the world. Now, holistic healthcare should ideally embrace all of these different aspects. So what is palliative care and who does it apply to? The World Health Organization defines palliative care as improves the quality of life of patients and that of their families who are facing challenges from life-threatening illness, whether physical, psychological, social or spiritual. Now that's exactly what holistic healthcare is trying to achieve. The World Health Organization also tells us about barriers to providing palliative care, which include a lack of awareness amongst health professionals and the public about what palliative care is and the benefits it can offer. Also barriers about cultural and social issues, such as beliefs about death and dying. And then finally, barriers which are misconceptions about palliative care, such as it's only for patients with cancer, or just for the last weeks or days of life. If we assess holistic needs, we can identify those barriers. So why should we assess holistic needs for palliative care especially? Palliative care aims to provide holistic care for people facing serious illness. Healthcare professionals working in palliative care are usually too busy or may not be sufficiently trained to know how to look for holistic needs in their patients. Many healthcare professionals prefer not to ask patients about their needs because they don't want to get too much into their patients' lives and therefore to upset them. But although patients may be upset, they tell us that they still want to talk about their needs. Now, if we use structured holistic needs assessment tools, this makes the process of holistic assessment much easier. There are different levels of holistic needs assessment. The traditional approach for many years was basically a face-to-face interview between a healthcare professional and a patient. Now this only works if the professional is experienced, knows how to ask questions, and has plenty of time. From the US, we started having new developments such as the distress thermometer, a very simple scale for showing how distressed a patient was with their whole life in general. From there, there were developments of producing checklists of common symptoms and mood disturbance, such as feeling anxious or depressed, and these were scored very simply using just yes or no answers. Do you have pain? Yes, no. Do you have anxiety? Yes, no. Eventually, we started to develop more detailed questionnaires covering a much fuller range of holistic issues and also scoring the level of distress for each issue. So not just do you have pain or anxiety, but how much does it bother you in your daily life? Let's look at the SPARC model and how it's used in the UK. SPARC stands for Sheffield Profile for Assessment and Referral for Care. It was designed and tested in my department in Sheffield in the UK between 2004 and 2009, but it's continued to be developed and spread out across the world. Its original purpose was to improve access to palliative care. That's how it started. It provides a standardized way of measuring patients' holistic needs across many areas of life. It allows patients to be referred to appropriate specialists and services. Very importantly, it was designed from the beginning to be generic. That means it's not restricted to cancer or any specific stage of disease. What does SPARC screen for? It screens for physical symptoms, psychological needs, religious and spiritual issues, independence and activity, family and social issues, concerns that patients may have about treatment and side effects, help they may need with personal affairs, and need to talk to other professionals. Finally, do they have any extra information needs? Using SPARC, we can signpost patients to the appropriate specialist or the appropriate service to help them with those particular needs. Here are some sample sections from SPARC. It's called SPARC 45 because there are 45 questions. Firstly, we start with issues about communication and information. Have you been able to speak to any of the following professionals? Because many patients have only spoken to a surgeon and maybe a nurse or their GP. Then it moves to physical symptoms, and as you can see, we're asking, in the past month, have you been distressed or bothered by pain, loss of memory, headache, etc.? And we ask, was this not at all, a little bit, quite a bit, or very much? So we get an idea of how much the patients are bothered. Moving on, there are psychological issues. And then we have religious and spiritual issues, aspects of independence and activity, family and social issues, and then concerns that patients may have about treatment. Finally, personal issues about needing more help with their personal affairs, including finances. And then we finish with an open question. Are there any other concerns you would like us to know about? Patients have things which we haven't even thought about. Some patients may say, well, they're really worried about their pets or about their grandchildren and how they're going to talk to them. So they can write that down here. What are the patients' views on SPARC? While we were developing it, we showed it to a group of patients. There were 135 patients, and we analysed their responses. 5 themes emerged. They said it was easy to understand. They said it was quick to fill in. It took on average 10 to 15 minutes the first time they saw the SPARC. They felt it was relevant to a wide range of conditions, not just cancer, but to other conditions as well. And they thought it would be relevant to them now or maybe in the future. They also thought it was relevant for health professionals to know this information, but one worry they had was, will the health professionals actually use that information? Of course, they found some questions were sensitive, but they said you should still ask them because it's worthwhile to ask about death and dying and questions about sexual problems, for instance. So where is SPARC currently being used? It's been used in cancer clinics, it's been used in palliative care teams, in patients with cancer or heart failure or kidney failure. It's been used in a stroke assessment department, and of course it's also being used in research. So how is SPARC being used? Firstly, in daily clinical practice, SPARC can be used to assess patients' needs at key times of the cancer journey, at the time of diagnosis, also before starting each new treatment plan, whether that's surgery or chemotherapy or radiation treatment, at the end of treatment to see how they have changed with their needs. And then the first sign of cancer progression, we should assess their needs again. If patients are entering the end of life, that's a good time to again reassess their holistic needs. For patients who are free of their condition, say long-term cancer survivor, then we should be offering annual checkups using SPARC to find out if their needs are changing. Remember, SPARC is not only for cancer, it's for other chronic conditions such as heart disease or stroke or chronic lung disease. Very importantly, filling in a SPARC questionnaire enables professionals and patients to make a personalized care plan based on their particular needs. Another way that SPARC's been used is in service improvement and research. So, for example, SPARC can be used in clinical services to measure the needs of a population before and then to see how they change after starting new policies. SPARC can be used to justify increase in funds for more clinical staff, because if the patients are showing that they have needs for psychology or needs to see physiotherapists or social workers, then you could use that information to seek more funds. SPARC is available for research studies, such as identifying needs of a specific population, for example, people who've got a new physical disability, after stroke, for example. It can be used for comparing holistic needs between different disease groups, or comparing needs between different geographical areas within country, and interestingly also could be used for comparing needs between different cultures and other countries as well. There are implications for using SPARC for patients and professionals. The first thing is it does take time, especially for the first assessment. It can take half an hour, even an hour sometimes for the first time a patient sees it. When they do it again, it may only take 20 minutes or 10 minutes. You should be prepared to open up discussions of sensitive topics. We should warn patients that there will be sensitive issues there. You should be ready to act on identifying serious problems, knowing who to send the patient to get help, or if you've got time, to help them there and then. We should give patients the opportunity to continue the discussion if they want. Even after they finish the SPARC questionnaire, they may want to talk more about the issues that it's brought up. SPARC is now crossing international boundaries. That's relevant because holistic needs are universal across the whole of mankind. There are needs in specific countries which are modified by the economy, the local politics, the cultures, the health services, the availability of medicines and other health technologies, and these differ between countries. SPARC is a standardized tool which can enable international comparisons. Of course, we may have to make adjustments when comparing between countries because of different structures of healthcare systems or the availability of services and interventions. So in terms of how SPARC is being used more widely, we have a very strict process of forward-backward translation of SPARC from English into another language and then from the other language back again to English, and keep making changes till we get it right. That process has been completed and it's now in use in Poland, in South Korea. It's now still in translation and being tested in Taiwan and here in Colombia. We are very excited about this collaboration with Colombia and Northern Ireland to enlarge the family of SPARC users. Thank you very much.